Welcome. My name is Dr. Terrance Baker. I'm the host of Doctors in the House, NABNTV. Today, we're going to continue our discussion of Omicron in the news. By now, all of you have heard that Omicron is perhaps one of the most infectious viruses that the world has ever seen. Since it was first discovered around November the 24th, 2021, the virus has now taken over and is essentially 70% to 100% of all new cases being seen around the world. And in some nations like England, it has completely taken over as the number one virus causing disease. It's extremely contagious. The good news is that for vaccinated patients, the virus first presents like a common cold, a runny nose, cough, sore throat, body aches, fatigue, headache. Many people being diagnosed with Omicron, in fact, are presenting to doctors' offices, hospitals, and clinics for some other condition like a motor vehicle accident or some other concern, and are being diagnosed as having Omicron infections as well. Many Americans and patients throughout the world believe that the common cold symptoms that they are experiencing are nothing more than a fall winter cold. However, it's important to realize that in this pandemic, that if you have symptoms of headache, cough, congestion, sore throat, runny nose, you must consider that you have coronavirus, that you have Omicron coronavirus until proven otherwise. Millions of patients are trying to test in order to understand whether they have Omicron and is it safe for them to travel. That brings us to suggestions that I would recommend to you as a physician of 40 years, would recommend to you several considerations. Number one, if you're not vaccinated, I would carefully consider any travel plans that you have. If you're not vaccinated, I would highly recommend staying at home, canceling your travel plans. If you are vaccinated, I would consider canceling your travel plans if you plan to visit someone who is not vaccinated. If you do decide to travel, it's important to keep the visit short, and it's important to use N95 mask throughout the visit. Next, it's important to change your mask from cloth masks, which have little or no effect on Omicron, and change it to N95 mask. The Omicron virus goes right through cloth mask. And I'll give you a quick example you can do for yourself. Put some soup in a pot and bring it to boil. When you take off the lid, you'll see that there's large bubbles of water on the top of the lid. That's the size of particles that a cloth mask will block. However, the mist, the steam that comes up from the boiling soup, that is the aerosol that Omicron travels in for the most part. And if you put your cloth mask over that mist coming up from the boiling soup, you will see that the mist goes right through your cloth mask. And so I would recommend to everyone hearing this monologue today that you look at changing to an N95 mask. Next is hygiene. It's important to keep your hands washed and to keep the area around you, the environment that you're in, clean. Social distance 6 feet when possible, particularly when you're with strangers and you don't know their vaccination status. Consider with your family doctor the use of medications such as vitamin D3, NEC, vitamin C, and zinc. These medications have all been proven to assist your body's natural defense system to reduce the chance of getting infected, and if you do get infected, to shorten the course of the infection. You should remember to ventilate the environment that you're in, whether it's a car or your home. If you're visiting someone and it's possible to open windows, open doors, and to ventilate, that is a good thing. By ventilating, you reduce the amount of Omicron virus particles in your environment, and you give yourself a better chance of not getting infected by ventilating. Also, filtration, using filters that filter virus particles can also help to trap the virus and to prevent infection, particularly when you're indoors and visiting. Filtration and ventilation are very important. Beware of cold symptoms. If you develop cold symptoms, you must realize that you have Omicron until proven otherwise. Together, we can continue to go safely through this Omicron pandemic. The good news is that for those of you who are vaccinated and you do get Omicron, that the science that we're seeing is that the level of immunity, the level of immunoglobulins, the defense system that you develop seems to be improved, seems to be the highest that we've ever seen. So vaccination plus booster plus Omicron equals protection, a high level of protection. And then finally, it's important that if you haven't started your vaccination, it's not too late. Today, go and get your vaccination scheduled. If you're due for a booster, do it today. Currently, there are 60 million people in America that have been boosted, and there's about 250 million Americans that have received their vaccinations, one dose or two. It's not too late to get vaccinated, and I highly encourage you that vaccination is the foundation for safe living and to ensure that if you do get the Omicron virus, that your symptoms will be mild and usually will not require hospitalization and can be usually treated at home. This is Dr. Terrance Baker at NABNTV, Doctors in the House, wishing you and your family a blessed Christmas holiday season and a happy New Year.
NABNTV, inspiring a new generation.